Hello. Today is April 2nd, the day of my second post-op, and 3 weeks after the surgery, medial sesamoidectomy on the right foot. And my last video was more or less about the complications with the blood clot in my leg. But this video is more applicably about what this series of videos is intended for, which is the recovery from the sesamoidectomy surgery on the foot. And so today I saw the surgeon for the first time, and he answered some questions that I had for him that I may have asked before, but I was just too drugged to really remember what his response was. My main question was whether or not I was born with an extra sesamoid or if it actually just cracked in half. And he said that it had actually cracked in half. He couldn't tell when it cracked in half, but it looked like it hadn't been recent, which makes sense because I've been having this pain for many years. So the good news is the wound is totally closed up. They pulled the stitches out, which was luckily the most painful experience so far out of this entire ordeal as far as the incision site goes. So that's a really good problem to have. I haven't had any real pain at the incision site. And so actually what I'll do is I'll show you guys. It's a little bit, my foot kind of looks like shit because I haven't been able to wash it in 3 weeks. But they pulled the stitches out, and because basically the way I went to the doctor, I had my foot wrapped up in the surgical dressing inside a post-op sandal, but when they took the dressing off they just threw it away. And once I had the stitches pulled out, apparently it would be redundant to redress it because it's totally closed up and so forth. So since I didn't really have a sock, what they did was they just put these suture tapes over it, and the lady said that they just fall off on their own, which is kind of weird, I guess. I was told to that I can start bearing weight on the ball of my foot, although I should do it on a as what's comfortable basis. So if I begin feeling discomfort after 50 steps or less, just don't do it. I was just given the okay to just walk and just test the limitations. I was given restrictions: no running, no jumping, no lunging, and no walking in a way that would cause my foot to flex. I'm supposed to keep it straight. But the surgeon did say that when I'm laying around, or if I'm laying in bed, it would be a good idea to just move my big toe around, just kind of work out the tendons and get them used to operating the toe, which I'd already pretty much just already been doing. So any discomfort, he said, that I will be feeling over the next 3-4 weeks will be basically the soft tissues underneath the surface, kind of deeper in. Those are still healing, and that's where discomfort will come from, but there's no real risk that the incision will just pop open or anything like that. It's closed up nice and cleanly. It'll start looking better and better as I'm able to wash it and get the ink off of there. He recommended using some moisturizer to kind of bring the skin back to life. So it looks pretty nasty now, and kind of smelled nasty at first because it's been 3 weeks since I've taken a shower, including that foot. So I guess that's to be expected. But he said that we're gonna have another, obviously there's another post-op in, I think, 3 weeks from now, 28th it would be. 23rd. April 23rd. And at that time they're just going to evaluate what I'm able to do, what hurts, what doesn't hurt, and probably schedule a check-in for the 10-week mark. And we're looking at returning to work probably somewhere in the neighborhood of 12 to 14 weeks. So maybe 13 weeks. I don't know. The way I see it, if my company is willing to pay me, might as well not rush it, because I do hard manual labor. I'm on my feet all day at work. So why rush it if you don't have to, right? So that's my update. Update 6? I'm not sure. I don't remember the numbers anymore, but that's my update for April 2nd on my medial sesamoidectomy recovery. All my foot's just kind of tender right now. Haven't really tried walking normally. I imagine it would probably get pretty sore pretty quick if I did. But I'll probably make another video in the next week or so talking about what it's like trying to walk normally again, and whether or not I'm able to work my way into some normal shoes again. So thank you so much for watching, and I'll talk to you on the next update.